You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible.
When you know there's a problem, then you have to have a solution to the problem. And this is where, again, folks in the health arena must talk to black folks to say, hey, what are y'all hearing and seeing is the problem? Okay. And then how do we now deal with that? So what are the numbers? Are you seeing groups of folks who are young, who are college age, who are 18 to 35? Are they ambivalent about this, or are they embracing this? Which means let's get them communicating to elders as well. There has to be that, because I know some black people who like, man, ain't no way in hell I'm taking the vaccine. I had somebody on my Instagram page saying, man, I had on my goggles and my mask and my headphones when I was flying. Man, it don't take all that. I was like, look, I ain't bullshitting with COVID. Okay, I ain't trying to even be sick for 24 hours. So people say, ain't no big deal. Wasn't that bad. 480,000 people have died of COVID. Young people, athletic people, middle-aged people, teenagers, adolescents, older people. I am not about to sit here and play around. And if you tell me that I've got death, major sickness, and long-term effects, and as a vaccine, I'm like, sign me up for the vaccine. Maybe that's just me.
Is you, Roland? It's a lot of us, but I tell you what, brother, Dr. Hotez really, and thank you for having him on. You know, he raised a couple of things that are critical. One is access to the vaccine. Here in Washington, D.C., I was in a conversation today with some colleagues at Howard, folks who live in the upper Northwest along 16th, right out the window here, who had to go to Southeast D.C. to get their vaccine. And they said once they got to Southeast DC, because the center was put there, I guess, to encourage black folk, they said over half the folk they saw getting the vaccine were white folks who had driven in. So, you know, part of it is you got to open up more centers. The second thing that he raised is very important, is that those centers have to be, well, I'm saying this as well, they have to be strategically located. They need to be near churches, community centers, Prince Hall Mason's Lodge, Order Eastern Star, wherever the folks congregate, so that you can see people you know. And you know, Raphael Warnock said this, now Senator Warnock, on your show over a year ago. He said COVID-19 has exposed COVID-16-19. And so what you now see is, you know, I'm looking at things, and you've seen them all, Roland. You've been sharing them on social media. You get a black nurse or a black doctor, and she's inoculating an elder in a church. And you say, okay, this is a black woman inoculating an older black woman, and you begin to build trust that way. The other thing is, and this is the thing that, you know, yeah, those variants, this is serious, man. You know, South Africa has already shut down AstraZeneca because it's proving ineffective against this new variant that they have. So we got to worry about that tidal wave. But here's the issue, finally. What happens when, and right now they're saying, New York Times is reporting roughly about 5% of the population in the country have been fully vaccinated, and at least 12% have gotten at least one dose. What happens when those numbers continue to build and tip, and then you have an outsized group of non-white folk, particularly black and brown folk, who have not been inoculated? Will you then be fired? Will you then be coerced and said, if you don't take it, you're going to lose your job? And will there then emerge a kind of a two-tiered system, a kind of medical apartheid of sorts that say you can't come in this eating establishment, your child can't come to this school until they get vaccinated? We're setting ourselves up, in other words, for a very difficult future, not just in terms of the long-term effects, but perhaps even the politics of this vaccine. So, you know, by all means, if you can get it, go get it. And, you know, for the policymakers, right there where you are, you know, you got to follow what you did in Georgia, Roland. We got to roll into these places, talk to the people on the ground, listen to what they have to say, and you distribute the vaccine through those people that people trust. They're not watching TV to build trust.
Well, and that's it. And when you talk about building trust, when you talk about what we did in Georgia, that's what it was about. It was about being on the ground. It was about being able to go there. There was somebody who posted a comment on our one of our channels that said that there are teachers in Georgia. It says this is from Samuel Roland. Teachers from Georgia are driving to Alabama to get the vaccine because they allow teachers to get it there, and Georgia does not.
Yeah.
And so this thing is all over the place, Erica. And look, folks want to say, stop bringing up Donald Trump. But the reality is, this is an example of when you had an incompetent group of people that had no national strategy. They were like, hey, whatever you want us to do. And so we had Dallas County Commissioner John Wiley Price on the show. Well, Dallas County said, we're going to prioritize the communities that have been mostly impacted by COVID. Republicans in Austin, Texas say, oh, no, y'all can't do that. That's local control. They know what's best for their people. So that's what should have happened in this case. So what we're dealing with here are bureaucrats, politicians, in the case of Trump and his cronies, and Republicans allow it to happen, did not have a real, true, substantive rollout plan. And to Greg's point, and I've heard it, where you had stores on predominantly black towns, whole line white. It's 200 people in line and it's 10 black people. First thing you say is, hold up, y'all ain't never here. There's 200 white folks in line and 10 black people. Who knew? Who knew was available? Who was there? And so when people criticize, President Biden the other day saying, oh, he dissing black people, if a system is set up to set alerts on your phone that notify you when COVID vaccines are going to be in a particular zip code, if our folks are not that engaged with it, then we're not going to know. I'm just tired of people playing games with this because our lives are on the line. And we all know, Erica, in Georgia, Albany was ground zero for COVID-19 in 2020.
Absolutely, Roland. All these things are true. And you know that very well because you were in Georgia. You did work in Georgia. And the first COVID death that I experienced was the week leading up to my birthday. And it was a dear friend of mine that had passed away from COVID. They rushed her to Emory to get her on a ventilator, and she passed away. That was in March of 2020. So here we are. The previous regime had no interest in rolling out a COVID strategy. They had no interest in distribution and logistics. And so we are all paying the price for that. 493, 122 people later, now trying to hurry up and spin up. And so looking at the map, we pretty much have 50 different nations within the United States. And so within those nations are all of these different counties, and all of those different counties are functioning very differently. You may have more vaccine in one county than you do to the next. And then it just depends on within that state or county if they're operating through the tiered system, if they are saying that people who are healthcare workers are going to go first, and then the second priority are those people who are 75 plus with compromised systems. It just all depends on how it operates. So that is also the importance of what is happening within your state. How are they making sure that the shots are getting in arms equitably? That is something that has really been spun out for the states to make, and those counties to logistically organize around. And so when you talk about going into places where they are very much so the home of Black folks, but you see non-Black folks that are penetrating those communities to get the vaccines. Well, if we only have about 5 to 7% of physicians that are represented as people of color or Black people that are in that space, well, how are people who are supposed to be getting the vaccine finding out about it? If all of the people that are showing up to those particular places are reflective of the people that are actually providing the service, then there's that. But then you have a standout like a Dr. Ala Stanford of the Black Doctors Consortium, who through the snow today was still making sure that people were able to get their second dose for the COVID-19 vaccine. So, just to wrap it up, representation is definitely important, but it's also very important the way a state specifically is handling not only the distribution, but making sure that there's access to places that are rural that don't have pharmacies in their communities, right? They're not in affluent communities where there's CVS's in 2 and 3 different places, where clinics have been shut down, hospitals have been shut down, as going back to when Republican governors decided that they did not want the expansion of Medicaid within their states back in 2013. So now here we are in 2021, paying for many of those decisions that were made in the interest of party and not necessarily people. And so as people continue to see a lot of the disparities and inequities in their communities, do lift up those people that are doing their very best as Black physicians to make sure that there is equitable distributions within their communities.
Reese, again, we are being impacted, and if the word is not getting out in Black neighborhoods about vaccines being available in Black neighborhoods, I say to those who are in charge, get with the people who know how to communicate with Black people.
That's right.
Absolutely. And I think that the Biden-Harris administration in particular is trying to do that. I saw Dr. Marcella Nunes-Smith, who is head of the COVID Racial and Ethnic Disparities Task Force of the Biden-Harris administration, doing an interview with the Shade Room. And this is where I have to, make a very unpopular statement and say that as Black people, we need to come to terms with the disinformation and misinformation in our community. Now, there are a lot of Black people out there that are doing everything that they can to get the vaccine, and there are disparity issues, there are access issues, but there are a good number of Black people out there that are spreading disinformation about the vaccine. There are people who are anti-science, they're anti anything. And let me just say something to those people. You are not outsmarting the government by not taking the vaccine. The government is not trying to kill Black people through the vaccine, because it's a real ass backwards way of going about it, of trying to kill Black people through the vaccine, but you got all the white folks signing up to take it. How does that make sense? I know at my job, every time there's some appointments available, I get an email there, and these people are snatching up these appointments. Okay, so why don't we band together? And there are a lot of people doing that. I'm not saying that nobody's doing that, but why don't we band together and try to help each other get these appointments that the white folks are snatching up, instead of banding together in many cases and spreading disinformation, trying to sow confusion and doubt about the efficacy of the vaccine, because we are disproportionately impacted by it. Juices and berries is not going to protect you from COVID. Okay, it's just not. There's no clinical evidence to show that. There's clinical trials that have been done. This is a worldwide galvanization of science. It's utilizing decades worth of science. This is not science that popped up out of nowhere. It's leveraging decades of research. Do the actual research from reputable sources, not from your YouTube scholars, not from your Instagram scholars. I don't understand why when people see some random person who makes a video about their face being half frozen for a day, take that and say, oh, no, I'm not going to take the vaccine. But you ignore all of the science, you ignore all of the experts. And when you do see experts come into our communities and try to communicate to us, then you have this hostility and this cynicism towards them. So there's an amount of responsibility we have to take within our communities to combat the disinformation, combat the misinformation. And I understand this whole umbrella of mistrust and Black people have been done wrong by the system. And we're going to talk about racism in healthcare. But at a certain point, we are part of the problem when we allow this anti-science, this completely wrong information to spread and permeate in our community. And we almost make it a badge of honor to be anti-vaccinations and to be.
But Reese, truth be told, one of the reasons why that kind of stuff can spread in our community, because frankly, we largely have entertainment and sports sources, and we don't have news. Spit straight up. I'm talking when you study, again, more than 50% of African Americans get their information from radio, from Black radio. Mm-hmm. Well, if all you're doing is playing music and you're not actually talking about this and you don't have guests like the doctor on, guess what? Folks are just jamming away, not getting any information. And so I'm a firm believer in, again, you diagnose what the problem is. And this is why I'm saying that, yeah, it was great that she did the Shade Room, but that can't be a one-off. It has to be a consistent thing. It has to be a consistent messaging, right, which is critically important. And again, there are people who understand that.
All right, folks, back to that Roland Mark Unfiltered video in just one moment.
It's time to be smart. When we control our institutions, we win. This is the most important news show on television of any racial background. Y'all put $2, $3, $4, $5, $10, $15, $20, $30 on this and keep this going. What you've done, Roland, since this crisis came out in full bloom. Anybody watching this, tell your friends. Go back and look at the last 2 weeks, especially of Roland Martin Unfiltered. I mean, hell, go back and look at the last 2 days. You've had sitting United States senators today, Klobuchar and Harris. Whatever you have that you can bring to Roland Martin Unfiltered to support it, please do, because this information may literally save your life.
Watch Roland Martin Unfiltered daily at 6 p.m. Eastern on YouTube, Facebook, or Periscope, or go to RolandMartinUnfiltered.com. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com.